Have you ever wondered why a simple mole on your skin could be a matter of life and death? Well, today we're diving into the world of melanoma, a type of skin cancer that begins in melanocytes. These cells are responsible for producing melanin, the pigment that gives color to our skin, hair, and eyes. Melanoma is a bit of a chameleon, as it can appear anywhere on the body, not just where the sun shines. It could show up on the soles of your feet, under your nails, or even inside your mouth or nose. It's not picky about its location, which is part of what makes it so tricky. And while melanoma is less common than other types of skin cancer, don't let that lull you into a false sense of security. This particular cancer has a bit of a reputation. It's often more dangerous due to its ability to spread to other parts of the body if not detected early. Melanoma, though less common than other types of skin cancer, is often more dangerous due to its ability to spread to other parts of the body if not detected early. What makes one person more susceptible to melanoma than another? Great question. This is where we delve into the risk factors associated with melanoma. Firstly, let's discuss ultraviolet radiation. You've probably heard of UV rays, right? They're invisible rays of energy from the sun, and they're more potent than you might think. Overexposure to these rays, whether it's from the sun or artificial sources like tanning beds, can cause damage to the skin cells. This damage can trigger mutations or genetic defects that lead the skin cells to multiply rapidly and form malignant tumors, essentially melanoma. Moving on, let's consider moles. Although having many moles doesn't automatically mean you'll develop melanoma, it does increase your risk. This is particularly true if you have unusual moles. These are moles that are larger than normal and have an irregular shape or color. They're more likely than ordinary moles to become cancerous. Now, onto family history. Like many other health conditions, if you have a family history of melanoma, your risk of developing it is higher. Specifically, if one of your parents or siblings has had melanoma, your risk is significantly increased. Lastly, we have fair skin, hair, and eye color. If you have less melanin in your skin provides less natural protection from UV radiation. Similarly, if you have red or blonde hair, or blue or green eyes, you're also at a higher risk. But it's important to remember that these risk factors don't guarantee you'll get melanoma. They simply mean your risk is higher. Likewise, even without these risk factors, you could still develop melanoma. It's a tricky beast, which is why awareness and vigilance are so important. So to recap, overexposure to UV radiation, having many or unusual moles, a family history of melanoma, and having fair skin, hair, and eye color. These are all factors that can increase your risk of melanoma. Knowing these risk factors can help us be more vigilant and proactive in melanoma prevention. Stay tuned as we dive into the signs and symptoms of melanoma in our next segment. So how would you know if you have melanoma? This question might seem daunting, but the truth is, there are recognizable signs and symptoms that can help you spot this skin condition early. One of the most useful tools in identifying melanoma is the ABCDE rule. Let's break it down. The A in ABCDE stands for asymmetry. This means that if you were to draw a line down the middle of a mole or birthmark, the two halves won't match. It's like looking at two very different pictures. B is for border irregularity. Healthy moles usually have smooth, even borders. Melanoma lesions often have uneven, notched or scalloped borders. It's like comparing a circle to a jagged coastline. C is for color that is not uniform. Most benign moles are all one color, often a single shade of brown. However, having a variety of colors is another warning signal. A number of different shades of brown, tan or black could appear. A melanoma may also become red, white or even blue. D stands for diameter. Melanoma lesions are usually greater than 6 millimeters in diameter, approximately the size of a pencil eraser, but they may also be smaller when first detected. Lastly, E is for evolving. This is a big one. Look out for a mole or skin lesion that looks different from the rest or is changing in size, shape, or color. It's like watching a character in a movie that's always changing costumes. Now, remember, not all melanomas fit these rules. It's important to tell your doctor about any changes or new spots on the skin, or growths that look different from the rest of your moles. Other warning signs of melanoma include a sore that doesn't heal, spread of pigment from the border of a spot into surrounding skin or redness, or a new swelling beyond the border. Keep an eye out for these signs. Early detection is key in combating melanoma. Be vigilant and take note of any changes in your skin. It could be the difference between catching melanoma early and letting it progress unnoticed. Identifying melanoma is the first step, but how do doctors confirm it? Let's delve into the methods used to diagnose this type of skin cancer. The initial process starts with a simple skin exam. Doctors visually inspect the skin for any signs of melanoma, such as irregular moles or skin patches. The ABCDE rule, asymmetry, border irregularity, color variation, diameter greater than 6 millimeters, and evolving characteristics is often applied. However, visual inspection alone is not enough. If a suspicious spot is identified, a biopsy is performed. This involves removing a small portion, or sometimes the entire spot, along with a thin layer of surrounding skin. This sample is then examined under a microscope to check for cancerous cells. There are different types of biopsies. An excisional biopsy removes the entire mole, while an incisional biopsy only takes a part of it. A punch biopsy, on the other hand, removes a circular section of skin including deeper layers. The type of biopsy depends on the size, location, and other characteristics of the abnormal area. But what if melanoma has potentially spread? This is where imaging tests come into play. CT scans, MRIs, and PET scans provide images of the inside of the body, allowing doctors to check if melanoma has metastasized or spread to other parts. In some cases, a procedure called a sentinel lymph node biopsy may be performed. This is especially true if the melanoma is thicker and has a higher risk of spreading. In this procedure, doctors identify, remove, and examine the sentinel nodes, the first nodes where cancer would likely spread. These diagnostic tools and procedures, combined with the patient's history and symptoms, aid in accurately diagnosing melanoma. Remember, early detection is key in dealing with this type of skin cancer. The sooner it's caught, the better the chances of successful treatment. So, while these diagnostic procedures may sound daunting, they are crucial in the fight against melanoma. A proper diagnosis is critical to determining the right treatment course. So, you've been diagnosed with melanoma. What comes next? Well, the management and treatment of melanoma largely depend on the stage of the disease. The earlier it's caught, the more treatment options are available, and the better the outcomes usually are. For early-stage melanoma, surgery is often the first line of treatment. The primary goal of surgical treatment is to remove the cancerous growth and a margin of healthy skin around it. In some cases, lymph nodes nearby may also be removed and tested for the presence of cancer cells. If the melanoma has advanced, other treatment options may be considered. These could include radiation therapy, which uses high-energy rays to destroy cancer cells, or immunotherapy, which boosts the body's natural defenses to fight the cancer. Another option is targeted therapy. This uses drugs that specifically target the changes in cancer cells that help them grow, divide, and spread. These drugs can be particularly effective for melanomas that have certain gene changes. Chemotherapy, which uses drugs to kill cancer cells throughout the body, may also be an option, particularly for melanomas that have spread to other parts of the body. Each of these treatments comes with its own benefits and risks, and the choice of treatment can depend on many factors, including the stage and location of the melanoma, the patient's overall health, and their personal preferences. Once treatment is completed, follow-up care is crucial. This involves regular checkups to monitor for any signs of recurrence and to manage any side effects of treatment. It's also important to adopt lifestyle changes, such as protecting your skin from the sun, to reduce the risk of new melanomas. Remember, melanoma is a serious disease, but with prompt detection and appropriate treatment, many people can expect a good outcome. While melanoma can be a scary diagnosis, with early detection and the right treatment plan, it can be managed effectively. So take a deep breath and let's face this challenge together. Today we've taken a deep dive into the world of melanoma. We started our journey by understanding what melanoma is, a type of skin cancer that develops in the melanocytes, the cells that produce melanin. We then explored the risk factors, underscoring the importance of avoiding excessive sun exposure and understanding our genetic predispositions. Moving forward, we delved into the signs and symptoms, highlighting the ABCDE guide asymmetry, border irregularity, color variation, diameter greater than 6 millimeters, and evolving characteristics. We emphasized that any changes in existing moles or new skin growths warrant medical attention. Our journey continued with the diagnosis process, which often involves a skin exam and biopsy. We concluded with a discussion on management and treatment methods, which range from surgery and radiation therapy to immunotherapy and targeted therapy. As we wrap up, let's remember the key takeaway. Early detection is the best defense against melanoma. Stay vigilant, stay safe.